So let's talk about the law for a second. So in 1914, my friend Steve Arians told me about this. Hi, Steve. I'm going to send him this. He's a pharmacist, and he runs a website called Pharmacist Steve. You've probably seen it on the links on my Facebook page. He's quoting this a lot. There was the Harrison Narcotic Act of 1914, where prior to 1914, opiates weren't illegal. They were readily
Cocaine was in Coca-Cola till
right.
then.
That's right. Opium was in laudanum,
Yep.
etc. People got addicted. People didn't like the fact that they got
Coke
addicted.
was the real thing back then.
Coke was the real thing. The difference between the prohibition of opiates and the prohibition of alcohol is that there were so many more consumers of alcohol. You couldn't prohibit it and get away with it. But they prohibited, narcotics became illegal in 1914. And the thing I've learned from Steve is that we're treating medical issues with substances that have legal issues with them. And those two systems don't do well together. The law enforcement people are absolutely convinced that anyone who's on an opiate for a long period of time is selling them.
Right.
They're certain of it. You know, they've designed a system to avoid doctor shopping. Well, guess what? Everybody who walks through my door is shopping for a doctor. It's an urgent care, for God's sake. So everybody's red flag. And I love that term, red flag. What is a red flag? Is it a fact?
No,
or is it a warning?
No, it's an alarm.
A red flag is a warning. You know, if your blood pressure is too high, you might stroke, so we're going to treat your blood pressure. High blood pressure doesn't mean stroke, but it's a red flag for stroke. So certain behaviors that people engage in are seen as red flags for possible diversion. Kind of felt good. Yeah, it felt like Jim Carrey then. Diversion. So, like, well, what is diversion? It's basically when people sell their pills. But people who are in pain don't sell their pills. They'd have to buy them back at twice the price. Like, that just where does that make any sense? So, considering that the criminals are in this room, I mean, we're all criminals, but that considering that you're all the dealers, it's radically inaccurate.
That's true.
And
Absolutely
it's
right.
just barking up the very wrong tree. Unfortunately, if you're an agency that depends on enforcing the law, you've got to find some criminals. It's just how the diversion thing kind of continues to work.
Who's behind it? Local DEA, U.S. Attorney's Office? Who's the big law enforcement push? Or you can't tell?
You can't tell. This is unwritten rules.
Well, and they're also drug testing people on probation now for it, and they're also, and they actually monitor people, people on probation, if they're actually taking the amount that they're supposed to be taking.
Yes.
But who are they?
But you
Like
see, the
local
thing is
cops?
with the laws,
The
right?
probation office,
Probation officers
adult
will do
probation.
that. Yeah.
With laws that are made, isn't it the same thing that they should have guidelines also too, like a list of, you know, what constitutes a person having pain medication or these narcotics or whatever?
Well,
You know,
let's talk
and-
about that. That's really great because this is talked about as an epidemic, right? So there's an epidemic of prescription drug abuse. There's an epidemic of prescription overdose deaths. There's an epidemic of this and that. I saw today an epidemic of chest pain and coronary disease. I mean, everybody uses this term epidemic quite liberally. It turns out that we know about an epidemic and we know how to do it. You know how I know? Ebola. Okay? The guy went to Dallas, his diagnosis was missed, and a lot of people got exposed and he died. They know where those people were for the last 2 weeks prior to their exposure to Ebola. The doctor who came back from Sierra Leone to New York City, they know what subway he went on, they know what bowling alley he bowled at, they know what movies he went to and what restaurants he ate at after he got to New York City. We know how to find people that are actually a threat to our society. So this is a law enforcement issue, and find the people that are selling and jail them and leave the people that aren't selling to have their relief. I mean, I think it's pretty clear to me.
Well, some of it's the cops involved. They, once, when their friend's out on the street buying drugs, and then the cop gets them from the one that's doing it.
Yeah, it's interesting when enough time goes by, like decades. I watched a show on the cocaine thing in Miami in the 70s. They now acknowledge that the Miami skyline was built with drug money. billions of dollars of it. Think about billions of dollars that'd fill this room.
Yeah,
What do you do with it?
well, the Vatican has some dirty money too. I mean,
Yeah.
money,
So guess what? They're not gonna legalize pot or coke or anything else because the big money's in keeping it illegal. And that finds its way into every system, law enforcement, you name it. We all know all these drugs come from Colombia, right? I mean, everyone knows that. Doesn't make any difference. They bust just enough to say we're actively trying to shut it down and let about 90% through. Come on.
well, Afghanistan had their largest crop of opium.
Back
this year.
in Vietnam, the Golden Triangle, it was all about opium and protecting that. It's a drug deal. It's drug wars are true.
Yeah.
But it's prohibition type stuff. Your powers that be with real friggin' loose money, suitcases full of it, are the criminals. And they're making the laws. They're making the laws to keep it all illegal.
I was looking to see what Kate had to say.
In Holland,
Yeah.
it's illegal and it works really good. They don't have to deal with,
It's illegal and it works really good.
What's
No,
illegal?
it's legal.
It's legal.
What's
What's legal?
everything?
That's why you go to jail.
The drugs.
Drugs?
And
Yeah,
a lot of
I
people
saw a
go to
documentary on that.
Amsterdam,
They legalized heroin.
Red light district.
Yeah,
Well, Switzerland has a legal heroin, they have heroin. clinics.
Yeah,
You go in and
that's
get
it.
your fix, and there's a physician there, and you get your amount that you're supposed to have, you shoot right up there in the clinic, if you overdose, he comes and zaps you with Narcan.
Portugal passed laws just recently. They within the last 2 years, decriminalizing narcotics. I think it's still a crime to have it, but it's not a crime to buy it, and it's a crime. It is a crime to sell it. So they've decriminalized it somewhat, and their rate of addictions have dropped like 50%.
yeah.